For more, we're joined by Dr. Bob Wachter, chair of UCSF's Department of Medicine. Dr. Wachter, good to have you on here today. And we have reached a heartbreaking milestone in this country. 500,000 people have now died from COVID-19. That is more deaths than any other country on earth. What are your thoughts as we reach this staggering toll here? And how did we get here?
Well, it's such a hard number to get your arms around, and also to think about each one of those as a single individual. It's staggering. It is now more than the population of Atlanta. If you've ever been to the University of Michigan football stadium, it's one of these stadiums that seats 100,000 people. It's five of them, all of them dead. It's remarkable. How did we get here? I mean, the pandemic was destined to be bad, and we would have lost. I think I can't conceive of having lost fewer than 100,000 people, but I think San Francisco has proven that if we had handled it better, we could have lost 100,000, maybe 150,000 people. Last year was just terrible, and hopefully we're turning a corner and we will not see another 500,000. I think I'm starting to feel pretty optimistic about the way things are moving, but it's a staggering toll.
Oh, it certainly is. Speaking of things moving in the right direction, of course, here in California, we are seeing coronavirus cases. They are dropping significantly. The 7-day test positivity rate has fallen now to 3.1%. We have hospitalizations that are down significantly as well. What do you believe is driving this, and how much of this has to do with the rollout of the vaccine? Almost 2 million people vaccinated in California.
Yeah, I think we're beginning to get to the point where the vaccine is making a difference, but I don't think that's all of it. You know, the history of these surges is they go up, they hit a peak, and they come down. This one lasted longer and was worse than the prior two. People change their behavior when you're in the middle of a surge. Uh, I do think that immunity is making a difference, but probably more from natural immunity, particularly in Southern California, than from vaccine related immunity. But we're now getting to the point where enough people are vaccinated, plus people who were infected and are immune from their infection, that is exerting a significant downward pressure on the curve. We're now way past the Christmas holidays. So, you know, all the things that were sort of driving the size and the length of the past surge are beginning to go away. And I think we're going to end up at a pretty low level. The question is whether we completely let our guard down, in which case it will come back up, or we're able to keep acting responsibly, in which case we may be moving toward the end stages of this pandemic.
And speaking of the end stages, and obviously, you know, everyone keeps trying to look for that light at the end of the tunnel, and sort of an end to the crisis that we're in. There was this op-ed that was written by a professor at Johns Hopkins University, Dr. Marty Makary, and he, in essence, in a Wall Street Journal piece, predicted that he thinks the country is going to reach herd immunity and be in a place where COVID-19 is mostly gone by April. What do you think of that assessment? Do you agree, or does that seem overly optimistic to you?
Seems overly optimistic to me. I think Marty's point was that this is what the science says, and nobody wants to say it because they don't want to spook us, and they don't want people to change their behavior. And there probably is a little bit of, we're hearing a lot of pessimistic assessments to try to make sure people keep their guard up. But April is pretty aggressive. I think that when you really look at the numbers, you look at the number of people that are immune from past infection, which we assume is still holding now, although we're now a year out from the time some people were infected, the immunity from vaccinations, the speed of the vaccine rollout. I don't think it's unreasonable to believe that by late May, early June, we'll be in a position where there's a lot of downward pressure on the curves. That the number of people vaccinated, the number of people who are immune from prior infections, could put us in a point where there are very few new infections. The big curveball is the variants. And the variants are here and they are spreading at about the rate that we worried they would. And that's going to put some upward pressure on the curve. And those two things are going to compete against each other. If it weren't for the variants, I think he might be right. We might be late April, early May. We may be at a point where enough people are immune from either vaccine or from infection that we'd be close. I think the variants make that a little bit too optimistic, but I'm pretty optimistic that we could be looking at a very different world by June.
All right. Well, certainly good to hear, but we have to keep at it with the safety measures and the precautions, of course, and continue the rollout of the vaccine and ramp that up. Appreciate your time as always, Dr. Bob Wachter, chair of UCSF's Department of Medicine. Thanks for coming on.
My pleasure, Alex. Thank you.
Take care.